pleasant good morning and a very warm welcome to the Ministry of Health's update on the national COVID-19 response for Monday, 11th October 2021. I do hope that your weekend was a safe one and your week ahead is productive and fulfilling. The TT Safe Zone is now in effect, which allows vaccinated persons to recreate in safe spaces. We are asking all patrons and owners, operators, to adhere to the guidelines provided in the Safe Zone policy. You can visit www.health.gov.tt/safezone for more information. And yesterday, October 10th, Trinidad and Tobago, along with many countries around the world, recognized World Mental Health Day. We here at the ministry want to encourage you to continue taking care of your mental health and well-being, because there is no health without mental health. Our panelists for this morning's update are Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, Dr. Adesh Surju Singh, Director in the Directorate of Women's Health, and Mr. Lisha Baksh, Chief Executive Officer at the Northwest Regional Health Authority. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health and moderator for this morning's update. Dr. Hines will begin with the latest clinical, vaccination, and epidemiological updates. Dr. Hines.
Thank you, Mr. Alexander. Good morning to my colleagues, Dr. Surju Singh and CEO Baksh. Good morning to members of the media, members of the viewing and listening public. If we can go straight to the first slide, we'll go directly into the epidemiological update. Now, this data is at October 10th, that's yesterday, at 4 p.m., and at that date and time, we had tested 361,239 samples from both public and private facilities, and of those, 52,728 have come back as positive over the entire duration of our local pandemic. Out of those individuals, 46,790 have already recovered, and there are currently 4,387 total active positive cases that are divided as follows. There are currently 3,819 individuals in home self-isolation, 265 persons in hospital, and 55 individuals in step-down facilities. Within the last 24-hour period, 248 additional new positive cases were reported from samples taken between October 6th and October 9th. There have also been 1,551 COVID fatalities, and we extend our condolences to the members of those bereaved families. If we look at the vaccination figures, as at 4 p.m. yesterday, we note that the number of persons vaccinated with one dose of a two-dose regime or regimen would have been 596,696, and those who have completed the vaccination regimen, either receiving their second dose of a two-dose regimen or those who have received a single dose of a one-dose regimen, such as the Johnson & Johnson, those individuals currently number 546,532. And we'd like at this point to continue to encourage those who have not yet been vaccinated to make your way to the various health facilities and mass vaccination sites so that you can make use of the available vaccines to reduce your risk of both severe illness and of death. Before we go into the next slide, we just want to update the population that at this point in time, we have confirmed an additional 7 new cases of the COVID Delta variant of concern, which brings the total number of cases of the Delta variant to 49. Of those 7, 5 had no history of travel, meaning they were local cases. 6 had contact with symptomatic persons prior to being diagnosed. And of those 7 cases, there were 3 that were fully vaccinated, 1 that had received only 1 dose of the vaccine regimen, and 3 that were unvaccinated. So as we've said before, we have noted that this pattern of spread indicates that there is the likelihood of undetected chains of community transmission, and that we need to be additionally aware, additionally conscious, and additionally stringent in adhering to our public health regulations, and even more keen on getting our vaccinations to reduce our risk. Now, if we go to the next slide, the epidemic curve, we will see that the cases for the month of October, let's go to the next slide, please. that is the bright green bars over to the right-hand side, those again have continued at just about the same sort of height, same numbers or similar numbers as the past months of July, August, and September. And that dotted line, the rolling average, has remained in the vicinity of the 200 mark over the past 3 months or so, and we describe this condition or this situation as a plateau. If we move to the next slide, we see that that same data now aggregated at a weekly basis looks pretty much the same. We see very similar heights of bars from one week to the next, and that has been over that period from July all the way through to the end of September, start of October. And at the background of that, we see the positivity, that is the percentage of COVID samples that have returned a positive result. And that has hovered between the 25 and 30% mark in most cases, except for 2 weeks ago when it dipped a little below 25%. Now, we continue to look at that as an indicator of level of viral circulation, whereas it does not represent the percentage of persons in the population who may be COVID positive. It does represent the percentage of those who present to the healthcare system with respiratory illness who subsequently turn out to have COVID-19. So it's an indicator that we continue to watch. Let's move to the next slide. Same data now at a monthly time scale, and we see that plateau again demonstrating itself quite nicely in the July, August, and September bars being almost exactly the same height, and October continuing at just about a pace that should bring it to a similar total at the end of the month if the trend does not change. And at the background, we see again that salmon section representing the positivity, maintaining that height between 25 and 30% throughout that time frame. If we move to the next slide, we look at the demographics. That is the age and the sex distribution of the cases all the way from when community spread first was noted in July 2020 through to October 10th. And the shape of this has not really changed, meaning the majority of the cases remain in the age groups where they've been seen throughout, majority of them being in the 25 to 49 year age group, half and half male to female just about, and that has maintained itself throughout the course of the pandemic thus far. If we move to the fatalities, we note that in the next slide, if we note that the distribution is a little different. We have 2/3 of the cases who have passed on being above 60 years old. And we also note at the background of that we have a number of individuals, more than 80% of them, who would have reported some form of comorbidity, some pre-existing illness that would have contributed in some way to an adverse outcome. And again, this is the point at which we want to emphasize that if you do have comorbidities, if you have diabetes, hypertension, other pre-existing chronic disease, it is even more important that you get your vaccine to reduce your risk of becoming a COVID-19 fatality if you do get COVID-19. You may still get it, you will reduce your risk of getting COVID-19 at all, but in the event that you do actually get it, you still have a much reduced risk of having an adverse outcome, and I think this is an important fact that we can't overemphasize. So those with pre-existing comorbidities that are still questioning whether or not they should have their vaccine, the answer is yes, check with your doctors, and if once your doctors don't have any specific reason why you as an individual shouldn't have the vaccine, then by all means, make use of the available vaccinations. Next slide, please. Looking at the geographic distribution, continue, next, we see that as we've seen in the past, those population centers, those most or more densely populated communities within counties tend to be the ones that have the largest numbers and therefore the darkest coloration in this choropleth map. And if we move to the next slide, we see that if we compare 1 week against the previous for the weeks 38 and 39, the 38 being in purple, 39 being in gold, you see that most counties had just about the same number of cases from 1 week to the next. Some had small decreases. One county had a bit of an increase. But overall, those changes average out to just about the same number of cases from 1 week to the next. And this is what the plateau looks like when it's broken down at a county level. If we go to the next slide, we see what the behavior looked like by county over a longer period. Each bar represents one epidemic week, and each cluster represents different counties. And we see that those numbers have more or less remained in a given range, fluctuating both up and down. The last few weeks, the last 3 or 4 weeks, we've seen that some counties have had continuous increases, although they were small. Some counties may have had continuous decreases. Some have both increased and decreased in that time frame. So that lack of a specific direction, some going up, some going down, is what's maintaining the plateau, the similarity in figures from one week to the next at a county level and at a national level. So we'll finish with the slides, but as we move to looking at the current situation, the most important factors are as follows. Number one, the virus is still in circulation in the population, albeit at a fairly constant level over the past 12 or 13 weeks. Because it is still in circulation, we continue to advocate that everyone adhere to all of the public health guidelines. The vaccines are available. The vaccines reduce your risk of illness, they reduce your risk of transmitting your illness to anyone else, and they reduce your risk of getting seriously ill and the risk of having a COVID-19 fatality if you're infected. The vaccines are safe, they're effective, they're available, and we want to reinforce that call for everyone to make use of the vaccines and get your vaccination if you have not yet done so. With that, I turn it back over to Mr. Alexander.
And thank you very much, Dr. Hines. I now invite Dr. Surjit Singh to update us on how pregnant women and breastfeeding mothers have been faring in these current COVID-19 conditions. Dr. Surjit Singh, good morning.
Good morning, Al. Thank you. And of course, good morning to my fellow members of the panel, Dr. Hines and CEO Ms. Salisha Bash. Good morning to members of the viewing and listening public. So Al, just speaking more on a little broader topic today. It's actually an update on COVID-19 issues and women's health in general, covering some additional issues. I have a few slides prepared, and can I have the first slide? So, of course, I represent the Directorate of Women's Health, and we are responsible for matters related to improving health of our mothers and newborn babies. Next slide, please. So, of course, this is one in a series of updates that I have been providing. It's scientific information. Information continues to be gathered, and we will always present updated information. Sometimes things may change, and we will reflect that in these updates. Next slide. So this slide actually do have some more updated figures. This slide shows the number of births we've had at our public health institutions and our private institutions, so national data. We are now up to 10,650. I'm just collating the figures for September, and I will be presenting that at a later update. It remains 91% of these births are occurring in our public hospitals, with 9% in the private sector. Our system continues to be up and running. All systems are functional as with regards to maternity and newborn services. Next slide. So this is the updated figures, and again it's preliminary. There are some numbers we need to cross-reference and check. And you can see that the total number of cases now stands at 744 pregnant women who have been diagnosed with COVID-19 since the start of the pandemic. In September, we saw the largest number of cases reported at 161. To date for October, we have 21 cases. We are therefore still seeing a higher number of cases being reported in pregnancy in these last few months. Next slide. I've spoken before in detail about the vaccine and information on the vaccine, but again, just to tell us a little historical data, we approved the Cyanofarm vaccine initially since June 2021 as safe and approved for breastfeeding mothers who wish to avail themselves of that vaccine. We added, as of 25th of August 2021, the Pfizer BioNTech was added for women who had successfully gone into the second trimester and third trimester as an approved vaccine for pregnancy. And we also added the use of this Pfizer vaccine as an additional vaccine for breastfeeding mothers. Numbers provided to me this morning by Mr. Lawrence Jaising, our director in the Health and Policy Division, says that we had, as of the 9th of October, 714 pregnant women who have so far received the first dose and 374 who have received the second dose of the Pfizer vaccine in pregnancy. Next slide. I want to reassure those mothers listening out there and those who support them that the vaccine has been used widely worldwide. This number is rising. The database has over 300,000 pregnant women. It's much more now in real life in terms of practice. It is highly monitored. We are reassured by the safety of the vaccine. We have not seen any harm with respect to the vaccine. The vaccine protects the pregnant woman as well as protects your unborn baby through the passage of antibodies after receiving the vaccine, which are manufactured by the mother in pregnancy, as well as if you choose to breastfeed. There are no different side effects than what is being seen in the general population. I want to reassure the population that this is not a mandatory vaccine. It is highly recommended worldwide. The policy remains voluntary for pregnant women. You do not, therefore, need the vaccine in order to access services in Trinidad and Tobago, because there is some misinformation circulating out there. We highly recommend, however, to be vaccinated. Next slide. In terms of pregnancy again, we have already said that pregnant women, and I have some more slides later on to just show that, are at higher risk when compared to the general population. But we have another subset of pregnant women who are considered at even higher risk. And I've shared this slide before, but again to highlight it, if you are over the age of 35, the second half of pregnancy, overweight, you have diabetes. Diabetes remains a very common condition in pregnancy in Trinidad and Tobago, with almost 1 in 5 women being diagnosed with diabetes during their pregnancies. High blood pressure, asthma, and heart disease are additional risk factors. In our patients, so far, 2% of these patients would have ended up in the intensive care unit or high dependency unit. And unfortunately, we had, as reported before, 2 maternal deaths. Condolences go out to the families of these patients. Next slide, please. So this slide here, I just took this off the CDC's website, and this is new information. They are highlighting this in the form of an infographic, which says in the United States, they are seeing now, and they put this out as an alert, as we vaccinate more and more of the so-called high-risk persons, there's a trend in the United States to seeing more patients who are pregnant, who are unvaccinated, getting into the intensive care units. And they are again reinforcing that pregnancy is considered a higher risk condition if you contract COVID disease. Next slide. Similarly, in the United Kingdom, this is recent information. Again, this is coming straight off their websites. They are seeing the same information. And across the world, the trend is that more and more pregnant women are occupying the intensive care units. Next slide, please. So I need to just pay a little more attention to these in the form of slides so that you'll have this information to take home, as we have lots of questions continuing to follow with respect to menstrual disturbances and the vaccine. As regards the scientific community, and this is across the globe, no definite link has been established with respect to menstrual disturbances. However, research is ongoing across the globe. If there's new information, we will definitely share it. As it stands now, no definite link has been established. If you do indeed have a problem with your periods or there's some disruption, the first port of call would be to seek assistance from healthcare practitioners, especially if it's significant, if you have very heavy periods, especially if it's new or you are in the a postmenopausal woman and you haven't seen your periods for some time, definitely this holds not just for those who received the vaccine, but for all women. If you see bleeding and you have not seen your period in the postmenopausal woman, you need to be investigated. Next slide, please. And just again to talk about menstrual disturbances on a bigger level, these are some of the things that may affect a woman's period. So we all know this is already established. Stress can cause it. Changes in your weight, if you're gaining weight or losing weight quickly. In Trinidad and Tobago, as many as 7 to 8 women in every 10 will have developed fibroids in their late 30s or 40s, and some of these are what's called incidental findings. So fibroids are very common, as well as some other medical conditions. We have some big words there: adenomyosis, endometriosis. These are things your healthcare practitioners can discuss with you. Pregnancy. If you miss your periods, the first thing to check, if you are sexually active and not using contraception, make sure you're not pregnant. Polycystic ovary syndrome is another common condition. Thyroid disorders. So these are all very common conditions which can affect your cycle. Next slide, please. So of course, again, just to reinforce, see or discuss these issues with your healthcare practitioner if it's causing concern. I want to remind women, just to take the opportunity, that for those who are over the age of 20, between the age of actually 20 to 65, we do recommend at very minimum cervical pap smear screening for cervical cancer at least every 3 years. The public healthcare facilities with gynecology, maternity services, newborn services remain open and functional. If it's a minor problem, of course you can monitor it, but seek help if you need to do so. I think that's the slides, so thank you very much, Al.
Thank you very much, Dr. Surjit Singh. But before you go in, I mean, based on your presentation, it seems as though that unit is doing quite well, and the results are very good. And I'm wondering, and of course kudos goes out to both the healthcare providers and the support staff, but how are the maternity and newborn services doing compared to the rest of the world?
Right. Okay, good. Okay, so this is you're checking on our performance. Thank you, Al. So again, kudos, as you quite rightly said, to all our healthcare workers and the support staff worldwide. We recently had a conference with held with the University of the West Indies and the North Central Regional Health Authority. Honorable Minister was present there just a week ago, and we had some international colleagues speaking about their experience in the United Kingdom. And again, they said that their services, and they continue to be severely disrupted by the COVID pandemic. Maternity units were shut down. Patients were struggling to find beds, and this is in the United Kingdom. We are really privileged in Trinidad and Tobago as an overall response of the healthcare system, where this parallel healthcare system is supporting the work I do and my team do with the maternity and newborn services. We have kept things open. We are continuing to meet what are called the Sustainable Development Goals of 2030. Our maternal mortality figures are very low, as well as our neonatal mortality rates are very low. So we are performing very well when it comes to international benchmarks. The whole of Trinidad and Tobago should be proud of this achievement.
Great. But before I leave you, just one more question. Just bear with me.
Sure.
October is Breast Cancer Month, and I know that COVID-19 has impacted the way we do things. And how has that affected or impacted the screening process for women with breast cancer or testing for breast cancer?
Right. Thanks, Al. Yes. So actually, I did plan to talk a little bit about it, given the opportunity. So thanks very much. I just want to hold up something for the camera if they can see it. So this wasn't made up by me. It was made by the Co-op unit. So check yourself. Has to do with breast cancer. And I'd like members of the public, actually we have a very well-developed web page information on the Ministry of Health's website. Thank you. that is has a lot of information, not just about breast cancer, but about so many medical conditions, menstrual disturbances, vaccines, and all of that. So you can go to that website. You can get additional information about screening and so. Of course, as you said, with for October, breast cancer, we're trying to highlight breast cancer because breast cancer remains the commonest female cancer in Trinidad and Tobago. The statistics provided by the Dr. Elizabeth Quamener's Cancer Registry for the last we report in every 5-year periods, and it goes up to the year 2018. 1,100 women would have died from breast cancer, making it the #1 mortality from cancer in women for that 5-year period. And the other cancers that we always talk about, things like bowel cancers remain second, followed by now womb cancer, and fourth is cervical cancer. Luckily, cervical cancer programs are working. It's getting less and less. We have a lot of work to do with breast cancer. In terms of the screening, we have a national screening program that is in line with the PAHO, the World Health Organization, with the UK and so, where we recommend low-risk women between the ages of 50 to 70 to avail themselves of the screening modalities we have, which is a mammogram. So mammography is available at most of the regional health authorities. The services continue. Some may have been slightly affected, of course, some of these screening services, but you can call your regional health authorities. We also have NGOs that support us as well. So there are ways we can continue the screening programs. For women below the age of 50, if you're at high risk as well, you can consult your doctor to see if you need to be screened. And of course, on the website, you'll see some additional information about self-screening and examination. Thank you, Al.
Thank you very much, Dr. Surjit Singh. I now invite Mr. Salisha Bash to share with us the latest vaccination figures and how the one-shot and done vaccination outreach has impacted the vaccine uptake in the NWRHA. Good morning, Ms. Bash.
Dr. Hines, Dr. Surjit Singh, Mr. Alexander, members of the media, members of the viewing and listening audience, good morning. I thank you for the opportunity to provide a brief update on NWRHA's vaccination activities. This morning, I want to briefly speak to the trends that we would have noticed emerging from our vaccination data. So firstly, while in the earlier part of September, we saw a decrease in persons receiving a first dose of any of the vaccines, after the government's announcement of the Safe Zone initiative, there was a noticeable increase. And that increase would have been about a 40 to 50% increase. And we are thankful for that because we want to encourage persons to continue to come and get their vaccines. The daily administration of the Johnson & Johnson, which is the one-shot vaccine, has been consistent from September to present. And we are also equally grateful for that. From September 27th, we would have experienced a significant increase in our second doses of the AstraZeneca vaccine. And the large numbers of persons presenting themselves are just as a testament to the numbers who would have received their first dose of the AstraZeneca vaccine. And now being the time that second doses are due, we are now seeing a high uptake of second doses of the AstraZeneca vaccine. As it relates to the administration of the Pfizer vaccine to children between the ages of 12 to 18, at NWRHA, we would have administered 5,247 first doses to children, and second doses we would have administered 4,992. And those are really good numbers, and we want to encourage parents to continue to bring their children to get their Pfizer vaccines, especially in light of the additional forms that would be going back out to school, to physical schools. In an effort to make vaccines more available and accessible to the public, the Ministry of Health, in conjunction with the RHAs, would have launched our various outreach activities. And each RHA would update their relevant activities every week on their various social media pages. Particularly this Friday and Saturday, we were at the Kweze Promenade in San Juan, and the total number of persons, on both days we would have vaccinated, would have been 189. While this is a good number, we would have been hoping for more persons, and we want to encourage more persons. When we do our outreach activities and we pop up in an area near you, please avail yourself to be vaccinated. We want to protect as much persons as possible against the severe effects of the COVID-19 virus. Similarly, on Saturday, we were at the Diego Martin Community Center, and we would have vaccinated 131 persons, which was really good. And we thank the community and the persons in the community for coming out on Saturday and presenting themselves to be vaccinated. Last weekend at the Brian Lara Promenade, we were there for 2 days, and we would have vaccinated 251 persons, and we were quite pleased with that number, because this means 251 persons were now more protected against the virus. In total, all our outreaches that we had would have been done to date, which would have been the J&J, one shot and done vaccine, we would have vaccinated 1,224 persons. This means 1,224 more persons in the community are protected against the severe effects of COVID-19. And we want to applaud those persons who would have come out and presented themselves to be administered this vaccine. Now, as we continue, we will engage in further outreach activities. We would be there in more communities, more public spaces, and we would inform the public as time progresses as to where we would be next. Before I close this morning, I want to just highlight that yesterday, Sunday, the 10th of October, we recognized World Mental Health Day. And the pandemic has had a major impact on people's mental health, particularly healthcare workers, frontline workers, students, persons living alone, and persons with pre-existing mental health conditions. But I just want to remind the public, help exists. If you need help, it does exist. At NWRHA, we manage 5 mental health and wellness centers, and persons can visit or even call to make appointments if they so need that help. So I just want to list out our mental health wellness centers for the members of the public. So we have a Barataria Wellness Center, which is located on the Eastern Main Road at Barataria, and they can be contacted at 638-8562. We also have the Pembroke Street Wellness Center, which is located at 69 to 75 Pembroke Street, and they can be contacted at 623-9084. The Pitti Valley Wellness Center is located at the corner of Simeon and Moncoco Road, and they can be contacted at 637-3284. The Diego Martin Wellness Center is located at School Street, Diego Martin, and they can be contacted at 637-9308. And the Carenage Wellness Center is located at Constabulary Street, Western Main Road, and they can be contacted at 343-4946. Members of the public can visit the Northwest Regional Health Authority website for more information as it relates to the locations and contact numbers for the wellness centers. Our website is nwrha.co.tt. In closing, I would like to thank team at NWRHA as we continue to navigate during this pandemic to meet the needs of our clients and stakeholders. Their continuous daily efforts are applaudable as we continue to try and vaccinate as much persons as possible, because we all want to return to some sort of normalcy, especially in light of today being the launch of the Safe Zone initiative. We would like to continue in that vein, and therefore we are asking more persons to come out and be vaccinated. So don't delay, vaccinate today. I just want to remind you all, vaccines are accessible and are available. At the health centers during the weekdays, Monday to Friday, we are open from 8 a.m. to 2 p.m. and you can get either your J&J, Johnson & Johnson vaccine or Cyanofarm vaccine. At the drive-thru, which is located at the stadium, we are open from Monday to Friday, 8 to 4, and we offer the J&J, Johnson & Johnson vaccine, the Pfizer vaccine, as well as the Cyanofarm vaccine. And at the Paddock, Queen's Park, Savannah, which is our mass vaccination site, we are open from Monday to Sunday. So Monday to Friday, The opening hours are 8 a.m. to 3 p.m. and on the weekend, Saturday, we are open from 9 a.m. to 3 p.m. and on Sunday, 9 a.m. to 12 p.m. And at the paddock, we are offering the Cyanofarm vaccine, the Pfizer vaccine, the Johnson & Johnson vaccine, and we are also administering the second dose of the AstraZeneca vaccine. So we are open, we are available, we are accessible. Please visit any one of our sites to get your vaccine. And as I said before, we will be coming to a location near you and we will be advertising as the time progresses. Thank you, Al. That's my update for this morning.
Thank you very much, Ms. Bash. And you may notice that the panel is wearing these light green ribbons. That's to signify and recognize World Mental Health Day, which was celebrated October 10th. But in Trinidad, we celebrate World Mental Health Week. So all this week, we will be focusing on mental health. And so now we go to our question and answer segment. Our media representatives are reminded to state your name and that of the media house that you represent. Please identify the panelists to whom you wish to address each question. You will be allowed 2 brief questions in the first instance, and of course, time permitting, we will accommodate a second round of questions. We will take our first question from Guardian Media Limited. Good morning. Yes, good morning.
Everyone. Rashad Khan here from Guardian Media. Okay, so my first question is to Dr. Hines. Dr. Hines, the Safe Zone initiative was launched today. Have you all at the Ministry of Health been getting any sort of reports coming into you on how the day is going so far? Have there been any incidents? And my second question is to Dr. Surju Singh. Dr. Surju Singh, firstly, I just want a little clarification on something, right? You said that there was about just over 700 pregnant women who would have been vaccinated with at least 1 dose to date. But could you just indicate how much that overall demographic is? How many people are estimated to be pregnant at this time in Trinidad? And just to elaborate a little bit more on why it is that in September we saw so many pregnant women, so many people in this demographic being infected with COVID-19. Thank you.
Okay, thank you for your questions. The answer to the first one is short. It's still quite early in the day, so we haven't had any reports of how that initiative has been progressing as yet. We haven't had any reports of any incidents, and we just continue to monitor the situation, bearing in mind that anything that's launched will need to settle itself before you get the expected smooth running. So we will look out for what we hope is a good day and continue to monitor for any incidents if they should arise. Just to bear in mind, tagging on to the second bit of your questioning, just to remind you and the population at large that the way our pattern of pregnancies and deliveries goes, we tend to have a lot more individuals accessing and coming into the system and to the attention of the system around that September, October, November period in general. So while I'll defer to Dr. Surju Singh in terms of whether that may or may not have influenced those overall numbers, it is a pattern that we need to bear in mind. With that, I'll turn you over to Dr. Surju Singh.
Right. Thanks, Dr. Hines. Yes. So I think, so there are two questions I believe Richard is asking me. Number one is in terms of the numbers. So he asked me actually a hard question. I don't actually have all the data in front of me, Richard, as usual, but I have it in the office. So estimate for one calendar year, 15,000 women last year would have given birth, just around that, 15,500. In any period of time, you're looking at 2/3 in 12 months, second and third trimesters. So that's the focus group. So 2/3, so roughly 10,000 in an entire year, we would expect hopefully to avail themselves of the vaccine if it's offered to them. So it's still early days yet. I always say I have to analyze the data. So we said it's just over 714 persons would have availed themselves of the vaccines, and I say thanks to that. The other thing we don't have, however, is that I don't have that data, is we are seeing more and more patients who luckily got vaccinated prior to pregnancy, which is a good thing. So that's an additional cohort who are already vaccinated. More and more we are reporting that, but in time, these things will take quite a lot of time for all this data to come in. In terms of the increasing numbers, we didn't have a carnival this year. Normally you see the seasonal trends, right? So I have to point that out to you. So I'm looking closely at the data for September. I will have the full data by the 15th of the month, and I will get back to you in terms of these cases. But the screening process is that every patient who comes into hospital, we do as best as we can. We screen them with testing, who are having cesarean sections, who are displaying symptoms, who are coming in for admission and for labor. So the system is similar every month. We're testing in the same way, but we are seeing increasing numbers. And the slides I showed suggest that there might be a trend worldwide that more pregnant women are showing up because we are already vaccinating the high-risk patients. This is really why we might be seeing that trend, but we will only know this data in time. Thanks a lot for the question.
Thank you very much, Dr. Hines and Surjit Singh. We now go to the Express for your 2 questions. Good morning.
Good morning to the panel and everyone. My 2 questions are for Dr. Hines. Dr. Hines, can you say how many patients who have contracted the Delta variant have since passed away? And was the Delta patient whose death was reported yesterday vaccinated or not? Thank you so much.
Okay, thanks for the questions. With respect to the deaths from confirmed Delta variant cases, we have so far noted 2. Now, among the cases that we have had of Delta variant, we have had both vaccinated and unvaccinated individuals. So we have noted that both individuals with a full vaccination and those who have not been vaccinated, both sets of individuals have been affected thus far. Now, while we will not specify the vaccination status of a given individual, we are again going to reiterate that in general, across the board, the individuals who have passed on since vaccination has become available, the individuals who have passed on since the vaccine numbers and proportions have been rising, have been, in the vast majority, more than 95%, have been the unvaccinated individuals. So again, the importance of having the vaccine to reduce your own personal risk of having an adverse outcome is being emphasized.
Thank you very much, Dr. Hines. We now go to TV6 for your 2 questions. Good morning.
Hi, good morning to the panel. Alicia Boucher from TV6. My first question is for Dr. Hines. I wanted to find out, in relation to the 3 vaccinated cases of the Delta variant, were they linked or are they separate? And can you further clarify as to whether we have had any deaths among the vaccinated in relation to the Delta variant? So that's my first question. Second question is for Dr. Surjit Singh. I would have noted that hundreds of women in Trinidad and thousands of women across the globe have reported after taking the COVID-19 vaccine that they have had changes to their menstrual cycle. And yet studies have failed to link that to the COVID-19 vaccine. I was wondering, are there any challenges in terms of ascertaining that, and what are those challenges, and are we relying on just the data from international studies, or are we doing our own research to find out whether there's a link? Thank you.
Thank you. Dr. Hines?
Okay, thank you for the question. Now, the question of linkage between the vaccinated or unvaccinated, in the last set that we just had, a set of 7, what we would have found is that the cases, the majority of them weren't linked to each other, and there may have been, across the last 10 plus 7, 17 or so of the more recently established or documented Delta cases, there were a couple cases in which there were family members that were also diagnosed, so there may be an adult and a minor, that sort of arrangement, but there weren't direct links between the cases that you're asking about in this more recent grouping of the 7 Delta cases just spoken about. And again, as we mentioned, I'm just going to reiterate, so far, among all of the cases that we have noted of vaccine and vaccinated and unvaccinated individuals and those who have passed on, the vast majority have been unvaccinated. Those who have been vaccinated and still have passed on from COVID-19 have been those who have had very serious comorbidities. They are those who were, in a lot of cases, already somewhat, for want of a better word, medically unstable or at higher risk. And those are factors that would also contribute to a higher risk of an adverse outcome, even with a vaccine on board. Again, we are avoiding specifying vaccine status of individuals given the small number that we currently are dealing with, and we're looking at patterns. So as a pattern establishes itself, we will most certainly share that information against the backdrop of protecting the individual patient confidentiality. Thank you.
Thank you. Dr. Sujit Singh?
Okay, so again, thank you for that excellent question, Ms. Boucher. So, a couple things in that question there. So, just to correct the statements, now in terms of reports, of course, I know that people might be reporting through social media and so, and these are really difficult things to verify, I would appreciate, in terms of how persons report. In terms of severe effects, of the vaccine leading to persons ending up in a hospital, for example, with a period disturbance, I am regularly in contact with our heads of departments at all of the regional health authorities, and they have had no such reports of any vaccinated person having to be admitted to hospital as a result of some period disturbance. So that's the first thing. In terms of worldwide, for example, and I said this before, in the United Kingdom, 30,000 women were entered into their system, their regulatory body which monitors this. 30,000 women would have suggested they had menstrual disturbances out of 47 million women who received doses. So their regulatory body said they did not see any causal link with the vaccine and menstrual disturbance other than what is reported in the background population. Having said all of that, you can look again at the research. Institutions are being commissioned in the United States to do some further research on this. So we're not discounting it, but more research needs to be done, as you quite rightly said and appreciate. No one knows the actual incidence of menstrual disturbance, and this is a worldwide, it's not just Trinidad and Tobago with our limitations. The true incidence of menstrual disturbances in the background population before the vaccine, and it will be difficult to know after the vaccine as well. But we will certainly keep looking at the research and keep the population informed. I hope that answers that question.
Thank you very much, Dr. Sujit Singh. We go to 103 FM for your two questions. 103 FM?
Hello, good morning, everyone. Sarah Chandu from 103 FM. Both my questions are for Dr. Hines. First of all, Dr. Hines, could you say if samples from all persons who died of COVID-19 are being sent for sequencing to determine, I guess, the impact of variants in that regard? And also, there is a public concern over the announcement that was made on Friday by the Education Minister that vaccinated students in forms 1 to 3 could be back out to school in a couple of weeks. Now, I know it's an education decision, but the health ministry and health officials do inform policy. So given the current threat of a Delta fuel spike, is this a wise move right now? Thank you.
Dr. Hines.
Okay, thank you for the questions. At this point, the criteria for doing sequencing include a number of things. They include things like what sort of viral loads we're looking at, whether the pattern of illness leading up to death was something unusual as opposed to what has established itself as the sort of baseline expected sequence of events. So those criteria are the ones that are utilized to decide on sending something for sequencing. And it is not at present the practice to sequence every single death from COVID-19 for variants, especially as the pre-existing situation was such that the majority of the samples, the majority of the specimens that would have been collected would have been the gamma variant in the first place. So sequencing wasn't one of the things that would be triggered by a death, but it would be triggered by additional epidemiological criteria. So it's not just someone dying, but a few other things that would really give us the impetus to check for variants. That approach can be, and it may be modified depending on what patterns we see among the more recent or more recently occurring fatalities. So that may change. But at present, all the deaths would necessarily being sequenced, although a fair few of them actually were sequenced in the past. Now, the question on the decisions taken by the Education Ministry are questions that should be referred to the Education Ministry, and they will not be addressed at this forum.
Thank you very much, Dr. Hines. AZP News, we are ready for your questions. Good morning. Prior, could you turn on your mic?
Yes.
Yes.
Yeah, good morning, Prior Bihari, azpnews.com. My two questions are for Dr. Hines. Dr. Hines, first question, we have a lot of AstraZeneca and Pfizer vaccines that are about to expire. What is going to happen to them, if we don't have the window to administer the second dose? My first question. And my second question is, can you state for us exactly the two persons who have passed away and were contracted the Delta variant? Were they not fully vaccinated? Were they partially vaccinated, or were they not vaccinated? Thank you very much.
Okay, now a lot of the AstraZeneca that is currently on hand is reserved to those who had a first dose and are currently scheduled to have a second dose. And the vaccination or the vaccine expiry dates are being closely monitored as a decision needs to be made on what will be done or what needs to be done with stock that is at risk of expiry. The Minister of Health will make that determination, decision, and declaration. So that information, if a change or if anything needs to be announced, that will come from the height or the level of the Minister of Health. And I believe that I've responded at least twice to the direct inquiries on the two most recent Delta deaths and the individual vaccine status, which we are not going to speak about at this point in time because of the small numbers and the need to avoid making specific reference to the specific and individual health status of specific persons. I'm not sure how else we can say that, but as we are attempting to reiterate, the risk of death is lower if you are vaccinated, and the individuals who have been vaccinated and have still had COVID-19 and passed on have generally been individuals who have had pre-existing conditions that were actually quite severe, as a pattern establishes itself with respect to Delta in particular, and the rate of deaths among fully vaccinated individuals. That pattern will be described without the risk of referencing specific deaths. I'm hoping to have made that clear.
Very clear. Thank you very much, Dr. Hines. We now go to Power 102.
Good morning, Sparkle McIntosh, Power 102 Digital. Both of my questions are for Dr. Hines. Dr. Hines, although it may be considered a policy decision, would you recommend amendments be made to re-entry protocols for persons returning from the just concluded Miami Carnival celebrations, given that many social media videos showed a lack of mask wearing, physical distancing, etc.? My second question, as we await the rollout of the QR codes for COVID immunization, would it be acceptable for persons to have a scanned copy of their immunization cards on their mobile devices, as this would aid in convenience as well as the longevity of the physical card, given the material that it's made from?
Thank you.
Okay, thank you for the two questions. They're actually both policy questions. So with respect to the second, as the project and the work on digitizing that particular document is completed, the acceptance and the mechanisms and the modalities in which that document can be stored and presented will be decided upon, and then that will be declared. So that's not a decision that we will actually speak about at this point in time, but as the digitization goes forward, the mechanisms that will be accepted will be made clear, and those will be hosted on the ministry's website and also spoken about at the media releases. And you're quite right about the first one. Again, that would be a policy decision, so an internal conversation on risk versus benefit would need to be had, and then any policy changes on that would again be the domain of the minister or the prime minister to recommend and to make to the general population.
Thank you very much, Dr. Hines. Our last question goes to the Newsday. Newsday, we are ready for your 2 questions. Okay. Of course, I'm sure that the hard copy would be highly recommended.
At this point in time, the hard copy is what is recommended and what's being accepted. This is with respect to the vaccine card. What will happen in the future is going to be based on a number of things. So we can't make a determination of that right now, but it is always best to both have and to preserve your hard copy in the best way possible. And sometimes it's as simple as having it in a waterproof case, whether it's a waterproof sandwich bag or waterproof case. Just make sure that it is in something that protects it from harm and from being defaced accidentally. And also ensure that you can find it by putting it with your other important documents. As digitization rolls out and we have other options available, those options will be publicized.
So certainly this is a temporary measure in its first instance.
Yes.
CL Communications, you are last. We're taking the last questions from you. CL Communications, good morning.
Good morning, Natalie Singh, Caribbean Lifestyle Communications. You saved the best for last, right? I just have a minor question. What happens in a scenario where a person has taken a first dose of Cyanofarm, but after found out that they are pregnant? I was just wondering what happens in a scenario like that, given that Trinidad has only approved the Pfizer for pregnant women. Thank you.
Okay, so thank you for the question. And the other media panelists were smiling when you said that. You saved the best for last. So in terms of Cyanofarm, we did issue a communications from the Ministry of Health. Cyanofarm is one of those vaccines that isn't quite yet studied with respect to doses in pregnancy. So we are waiting on updated information. As it stands now, you are not allowed to mix vaccines. So if you took the Cyanofarm, became pregnant, you are not allowed to take the Pfizer vaccine during pregnancy. What I'm advising those patients to do is, of course, to protect themselves, other family members around them, get vaccinated, as we've been saying all along. During the breastfeeding period, we can look at the information and you can take your second dose of Cyanofarm at that time. Thank you very much.
Thank you very much, Dr. Surjit Singh. And that's all the time we have for our question and answer segment. In closing, we ask that you please continue to protect yourself and your loved ones. And do not forget to focus on your mental health. Take time to pause, breathe, reflect, connect with others. Keep a healthy routine. Be kind to yourself and others. Reach out for help if you need it. That said, for mental and psychosocial support, you can visit the Ministry of Health's website at www.health.gov.gt/services/mental health or www.findcareTT.com. If you haven't received your COVID-19 vaccine as yet, please get yours now. Don't delay. Vaccinate today. Be safe and goodbye for now.
How can we support the emotional well-being of older adults during COVID-19? During the COVID-19 pandemic, individuals, including older adults, may become more anxious, angry, stressed, agitated, or withdrawn. Here are 4 strategies that can help you in supporting an older adult. 1. present simple and accessible information and facts about the COVID-19 outbreak and the effective strategies to prevent infection. For older people with mild cognitive impairment or early stages of dementia, inform them of what's happening within their capacity. 2. Provide access to available mental health and psychosocial support services for older adults and communicate when and how they can access them. Help older people keep regular routines and facilitate communication between older adults and their friends and families. 3. Make sure that older adults have at least up to 1 month of all the regular medicines that they require. 4. Provide older people with details related to how and where they can get practical help if needed, like having groceries delivered and requesting medical care. For more information, consult the webpage of the Pan American Health Organization, www.paho.org/coronavirus.
I solemnly pledge to dedicate my life to the service of my God and my country. I will honor my parents, my teachers, my leaders,
and my elders, and those in authority.
I will be clean and honest
in all my thoughts, my words, and my deeds.
I will strive in everything I do
to work together with my fellow men
of every creed
and race for the greater happiness of all
and the honor
and glory of my country.
This is TTT, Live for Local.